Venlafaxine Hcl, also known as Effexor, is a medication used to treat depression. It can help improve your mood, increase your energy level, and restore your interest in daily activities. Venlafaxine is classified as a serotonin-norepinephrine reuptake inhibitor, SNRI, which means it helps restore the balance of certain natural substances, such as serotonin and norepinephrine, in the brain. The daily dosage of venlafaxine will depend on your individual condition and should be determined by your healthcare provider. It is generally recommended to take venlafaxine at the same time each day, with or without food. Be sure to follow your doctor's instructions and do not stop taking venlafaxine suddenly, as it may cause withdrawal symptoms. Always consult with your healthcare provider for the best time to take this medication and any concerns you may have. Before taking venlafaxine, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 2 to 3 times daily with food. The dosage is based on your medical condition and response to treatment. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. Take it at the same times each day to get the most benefit from it. Keep taking this medication even if you feel well, and do not stop taking it without consulting your doctor. It may take several weeks to feel the benefit of this medication, so tell your doctor if your condition lasts or gets worse. If you experience any new or worsening symptoms, report them to your doctor right away. Some common side effects of venlafaxine HCl include nausea, drowsiness, dizziness, dry mouth, constipation, loss of appetite, and blurred vision. It may also cause nervousness, trouble sleeping, unusual sweating, or yawning. If any of these effects persist or worsen, it's important to notify your doctor. Remember, this medication has been prescribed because your doctor has determined that the benefits outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects. It's important to monitor your blood pressure regularly while taking venlafaxine HCl, as it may raise your blood pressure. If you notice any serious side effects such as easy bruising, decreased interest in sex, muscle cramps, or shaking, it's important to contact your doctor right away. In rare cases, this medication may increase serotonin levels and cause a condition called serotonin syndrome/toxicity. Be sure to tell your doctor or pharmacist about all the medications you are taking, as the risk increases if you are also taking other drugs that increase serotonin. Seek medical help immediately if you experience symptoms such as fast heartbeat, hallucinations, severe dizziness, or unexplained fever. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. If you experience any side effects, it's important to consult your doctor for medical advice. When it comes to the uses of venlafaxine HCl, it is important to note that it is an antidepressant medication used to treat various conditions, including depression and other mental or mood disorders. This medication can also help prevent suicidal thoughts and provide other important benefits. It is crucial to talk to your doctor about the risks and benefits of taking venlafaxine HCl, especially for those under the age of 25. If you or someone you know experiences worsening depression or other mental or mood symptoms, unusual behavior changes, or thoughts of suicide, it is important to seek help immediately. Additionally, it is important to be vigilant for symptoms such as new or worsening anxiety, panic attacks, trouble sleeping, irritability, hostile or angry feelings, impulsive actions, severe restlessness, or very rapid speech, especially when starting a new antidepressant or when the dosage is changed. As for the daily dosage and optimal timing of venlafaxine HCl, it is best to follow the doctor's instructions and take the medication as prescribed. If you have any concerns or questions about taking venlafaxine HCl, be sure to discuss them with your healthcare provider. Before taking venlafaxine, it's important to talk to your doctor if you have any allergies to this medication or its inactive ingredients. Also, discuss your medical history with your doctor, especially if you have a history of bleeding problems, glaucoma, high blood pressure, heart issues, kidney or liver disease, seizures, or thyroid problems. This medication may cause dizziness, drowsiness, or blurred vision, especially when combined with alcohol or marijuana. It's important to avoid driving or operating machinery until you know how this medication affects you. Talk to your doctor if you are using marijuana. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications you are currently taking, including prescription drugs, over-the-counter drugs, and herbal products. Older adults and children may be more sensitive to the side effects of this medication, so it's important to monitor them closely. In pregnant women, this medication should only be used if clearly needed, as it may harm the unborn baby and cause withdrawal symptoms in newborns if used during the last 3 months of pregnancy. If you are breastfeeding, consult your doctor before taking this medication. And remember, if you have mental or mood problems, do not stop taking this medication without consulting your doctor. If you are planning a pregnancy or think you may be pregnant, talk to your doctor about the benefits and risks of using this medication during pregnancy. When taking Venlafaxine Hcl, it's important to be aware of potential drug interactions. Some medications can change how venlafaxine works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are some products that may interact with Venlafaxine Hcl, such as other drugs that can cause bleeding or bruising, including antiplatelet drugs, NSAIDs, and blood thinners. Aspirin can also increase the risk of bleeding when used with this medication, but if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. It's important to avoid taking MAO inhibitors during treatment with Venlafaxine Hcl, as this may cause a serious and possibly fatal drug interaction. Additionally, the risk of serotonin syndrome/toxicity increases if you are also taking other drugs that increase serotonin, such as certain street drugs, St. John's wort, and certain antidepressants. If you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, or drugs for sleep or anxiety, make sure to inform your doctor or pharmacist. This medication may also interfere with certain lab tests, so it's important to make sure lab personnel and all your doctors know you are using Venlafaxine Hcl. Lastly, it's important to avoid taking medications containing desvenlafaxine while using venlafaxine. If you or someone you know has taken too much Venlafaxine Hcl and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help by calling 911. You can also contact a poison control center for guidance. In the U.S., you can reach out to your local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center. Symptoms of an overdose may include severe drowsiness, seizures, and a fast or irregular heartbeat. It's important to seek medical attention as soon as possible if you suspect an overdose. Venlafaxine Hcl is a prescription medication used to treat depression, anxiety, and panic disorders. It works by restoring the balance of certain natural substances in the brain. It is important to take this medication exactly as prescribed by your doctor. The usual recommended dosage is once daily, with or without food. It is best to take it at the same time each day to help you remember. Lab and/or medical tests may be required while taking Venlafaxine Hcl, such as blood pressure and cholesterol tests. It's important to keep all medical and lab appointments and consult your doctor for more details. Do not share this medication with others and do not stop taking it without consulting your doctor first. If you miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose and resume your usual dosing schedule. If you forget to take a dose of Venlafaxine Hcl, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When taking Venlafaxine Hcl, it is important to store it at room temperature, away from light and moisture. Make sure to keep it out of reach of children and pets. Do not flush the medication down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, be sure to properly discard it and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.